Okay, Peggy, you had experience with robotic hernia, umbilical hernia surgery. Tell me about your experience. First, I'd like to hear how big was your hernia and how long you've been complaining about this hernia.
Well, the hernia I've had for probably about 30 years, and it just gradually started getting bigger, and the skin was getting thinner, and I had a large bulb outside of right by my belly button, and it got to the point where, while it was not bothering me for many years, it got the last year or so, it started getting harder, and I would have to try to push the hernia back in when it would pop out if I was doing anything heavy or pushing a lot and lifting a lot.
And especially your work is as nurses aide.
Yes, I'm a nursing assistant here at the hospital, and
So you move patients and stuff,
right,
so that
I'm
was
lifting,
interfering
right.
with your daily.
Yes, it would start hurting and popping out, and I would have to go and try to push it back in.
Okay, when I saw you at the office and I had recommended robotic hernia surgery and could you tell me about your experience with the surgery and aftercare?
Well, when I went to see you in the office, you had told me that you would recommend the robotic because it had a faster recovery time. You were able to do better things as far as, using the mesh and with sutures, I think, and not staples, and so less pain and everything. And I agreed to it, and I'm very happy that I agreed to it because I had virtually no pain. I took ibuprofen after the first day.
Okay, tell me about your belly button or your umbilical area before the surgery. How protruded? How much was it outside your abdomen?
It was probably about, I would say, almost like a baseball, or
So
maybe a little.
you would say an inch or an inch and a half or 2 inches outside your.
Yes, about
Okay.
2 inches, I think it was.
Okay, and tell me about how your belly button looked after surgery.
I got a belly button again. I am very happy about that.
Okay, and so you said you used ibuprofen after surgery.
Mm-hmm.
Did I give you other pain medications?
Yes, you did. You gave me, I think it was Oxycontin and
Oxycodone.
Oxycodone, and I took, I think, one the first day, and then after that, I just started taking the ibuprofen.
So, how long after surgery did you say you felt yourself?
Well, I took it easy for a little bit, but then I didn't lift up my grandkids or anything because I didn't want to take a chance on hurting myself that close after surgery, but I was acting normal and doing everything that I did before.
Okay, so would you say the surgery had a good outcome for you?
Very successful.
Would you have recommended to any of your family or friends?
Oh, yes, I would. My girlfriend, who is a nurse from Illinois, she had recommended me not to do the robotic when I told her that you had recommended it. And I said, no, I think I'm going to go with the robotic because that's what my doctor recommended for me. And she had also had a hernia. Hers was much larger, but she had a harder recovery because she didn't do robotic.